A lot has changed since those first 1 million COVID cases were recorded. We now have a handful of vaccines being distributed around the world, and we understand much better how this virus works. As we saw in that video, it's now almost exactly 1 year ago that President Donald Trump addressed the nation to mark the WHO's declaration of a global pandemic. While he announced travel restrictions, Trump displayed little alarm about the forthcoming catastrophe. Tonight, President Joe Biden will use his first primetime national address since taking office to talk about what America has been through as a nation over this past year. And here to share more about the year that's been is Bloomberg News senior healthcare editor Drew Armstrong. Drew, thank you for being here with us and for your incredible reporting over the past year. To start us off, I want you to take us back to your thought process this time a year ago. I want to know on a personal level, when did this start to feel real for you? And when did you start, turning to your friends and family and saying, you guys need to stay home and take this seriously?
So for me, personally, I was actually working very closely with our teams in China who had been covering this for almost 2 months at this point. And I remember around this time, as we had been seeing the spread of this virus globally, that, for me, reading what was going on in Wuhan and then kind of the beginnings of what was happening with global spread in Italy and some other places like that, this had been worrisome for quite some time, but I do remember having those conversations with friends, and a lot of people saying, I don't really see what's the big deal here. People were really not paying attention to it in the United States, and it was still just a relative small, very small number of cases here still at that time compared to what we've had since then. But it was a lot of kind of disconnect of, looking at all of the just absolutely horrific stuff we had seen coming out of China and then would later see out of Italy and other places, and realizing that, that story had just been repeating itself in cities around the world and that we probably would be no exception to that.
So did you feel a personal kind of duty to the people in your life to explain to them that this was coming because you were so read in on it, even, before the rest of us?
I think that one of the things that we were trying to do, and certainly the personal conversations that I would have, always tried to be really measured about what we knew and what we didn't know. And it was really, really important to, I think, in a situation like that, it became quickly obvious how much you didn't know about this. And I think the more you did to explain effectively to people what they could assume and what they couldn't assume based on kind of the very fast developing information we had in the science at the time, that I think was one of the most important things. I don't think anybody really had a good idea how dramatically it would change daily life. I mean, I remember having conversations with my wife about, do we send home our nanny at some point? What would it mean for our offices to be shut down? Do we need to go grocery shopping? All of those things. But I don't think anybody really had a great idea at that time, certainly, how drastically this would affect things and for how long.
Right. And you mentioned the kind of unknown elements of the entirety of this pandemic, and I'm sure that was challenging as a reporter. Looking back, what were some of the moments that really stuck out to you over the past year as just these huge kind of tentpole moments of COVID in the U.S.?
I remember in late March, actually, I lived just north of the city in New York, and I was out for a walk in between. I was probably working, 80 or 100 hours a week at that point because of all the news. And I was out for taking kind of a mental health break on a walk on the trail out by our house. And that's when I got the news that, New York City was essentially issuing a closing non-essential businesses. That felt like a real moment where all of a sudden everything changed, and you knew there that things were going to be different. That moment, and then watching kind of the rises and falls of the epidemic curve, but in particular the idea that this would go up, and then you would get a sense that after a decline, hey, maybe this isn't over. And you would watch the numbers kind of with a sense of dread as things ticked back up. And I think the worst of those was certainly during the recent holiday season over the winter, where you had just the coupling of widespread disease, people being really fed up with social distancing measures, the holidays, lots of travel, and that just brought things to the absolute worst point in this. That was definitely certainly a moment. And then, the most recent bit has been with vaccines, and that's been a much happier thing to follow.
Drew, extremely quickly here, my favorite question is the pandemic timeline. Can you tell me what the latest is on when we're going to reach herd immunity and how fast we're going to get these shots out?
Yeah, I was actually just looking at that calculation on Twitter. In New York, we're about 4 months away from covering 75% of the population. The U.S. is just a little bit behind that. But I will say that there's some significant disparities between states on that. I'd encourage people to go check out the Bloomberg Vaccine Tracker. You can take a look. Some states are much further behind, California, Georgia, and a number of others. I was a little surprised to see how big those gaps are.
Sure. Bloomberg's senior healthcare editor, Drew Armstrong, who's spearheaded our Bloomberg Vaccine Tracker. Really appreciate it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.